Now, I am really excited. I think a number of us, this was a request from members. Laura doesn't know this, but this was on our like wish list of topics for months, which is we need to learn more about Medicare's guide program. And so it was how we, who should we reach out to? And then phenomenally, Laura reached out to me and or other colleagues with AuthoraCare Collective. And it was really wonderful to be able to say, wait, can you come and start our year off telling us all about the Medicare guide program? I did have, Laura does know this, I had a little panic last night at midnight. I had asked Laura to send me some information as an introduction, and she did exactly what I asked, sent a bunch of information. I looked through it really quickly and just said, great, okay, and we'll see it. And then really read it last night and hadn't read the fullness of Laura's experiences and so I actually don't want to do too much of an introduction for Laura because I'd like Laura to be able to introduce herself and her experience and what brought, because like what has already been shared, you also come to this work from a very personal caregiving experience that motivated and brought your world into hospice care and palliative care and all kinds of services. So I want to let you tell your story, and then I've allowed sharing screens if you want to do that. But Laura, this is our first time meeting, though we probably have seen each other in other ways. But anyway, I'm so happy for you to come here and tell us all that we're needing to know about the guide program.
Thanks for having me, Heather. And first and foremost, I don't know what's going on with the lighting in my background. So if it keeps distracting you, I apologize and I can turn the camera off, but I've closed blinds and it seems to keep doing weird things. So anyway, yes, my name is Laura Foy. I'm with AuthoraCare Collective. And my background's in communications originally, but my whole kind of professional passion changed when I gave birth to a special needs son several years ago. And he had trisomy 13, so very complex medical needs. So I left the workforce to care for him for several years, and then ultimately his condition progressed to hospice and with AuthoraCare, as a matter of fact. So I was on their receiving side of services before I came to work for them, and I very much admire the work that my colleagues do, and it inspired me to come join that team so that I can provide such great support to others like they provided me. So happy to be here, happy to share about Guide. I hope it lives up to your expectations. I didn't know this was such a hot topic for so many to learn about, but I'm glad to be able to provide that information to you. So in case anyone is not familiar with AuthoraCare, I want to give a brief overview of it. So basically about 5 years ago, Hospice of Alamance and Caswell County merged with Hospice of Greensboro, and that was to form AuthoraCare Collective. And the purpose was to encompass more types of care than just hospice. So in addition to adult hospice and Kids Path, which is the pediatric hospice program my son was part of, we now offer palliative care, home-based primary care, where physicians will see individuals in their home, bereavement counseling, home health, veteran support programs, and now the guide program. We've got 2 campuses, one based out of Greensboro and one out of Burlington. And then we also have 2 inpatient units as well. We provide services to 12 different counties across North Carolina, but not all of our services are available in each county yet. The plan is to get there, but we're just not there yet. So But we believe in empowering patients to be the author of their own story, which is where the name comes from, author or Authora, care, and then collective because we have a interdisciplinary team that encompasses so many different service lines. So in terms of guide, in just last year, Centers for Medicare and Medicaid launched this 8-year pilot program, and GUIDE stands for Guiding an Improved Dementia Experience. And for this program, AuthoraCare had to go through kind of an extensive application process before CMS approved us to be a provider of this service. And currently in the state of North Carolina, there's only 15 approved organizations able to provide this. So we are very proud to be one of the organizations on the beginning stages of it. And more organizations will be launching in July that'll be able to offer this, but currently it's just a couple. So as far as GUIDE goes, the reality is dementia takes an incredible toll on not just the person living with the disease, but also their loved ones. And currently, there's approximately 6.7 million Americans living with Alzheimer's disease or another form of dementia. And by the year 2060, that number is projected to grow by nearly 14 million. So Medicare looked at these high rates of hospitalizations, emergency department visits that were associated with people living with dementia, and launched the GUIDE program to provide a better care culture for those individuals. The program aims to improve the quality of life, not only for the person living with the disease, but also their caregiver. So through the program, we do a series of comprehensive assessments, and by we, I mean care navigators, which is my role. And based on the results of those assessments, we're able to identify the areas in which families need extra support and can develop a care plan that is tailored to meet those specific needs. So as a care navigator, my role is to help families not only navigate the healthcare system and social service system, but also to help them understand what to expect as the disease progresses and provide solutions to manage those behaviors. So by providing support, supportive solutions, ideally we are implementing practices to keep the patient safe and preventing unplanned hospital visits or delaying the need for long-term care as appropriate. So before I go any further, I want to give you an example scenario that I think does a good job of outlining a family's experience before and after the GUIDE program. And this is a graphic that is available on CMS's website, but it's not too flashy. So rather than share my screen, I'll just read it to you. So Mildred is an 86-year-old woman living alone with moderate dementia. She has regular appointments with her primary care doctor, dentist, and optometrist, and gets her medications from a local pharmacist. Her caregiver, Anne, is her 35-year-old granddaughter who visits daily to help with housekeeping and personal care tasks. Anne is a mom with a full-time job. So the challenges before GUIDE, Mildred was experiencing worsening symptoms related to her dementia. Her primary care doctor was not equipped to treat her dementia. She needed help getting to appointments and taking medications. And Anne was burnt out as a caregiver and wanted to find Mildred a nursing home, but it was too costly. So after they were aligned to the GUIDE program, support that they received was Mildred learned about GUIDE from her doctor and starts working with an interdisciplinary care team. Her care navigator connected her to transportation services, so that was no longer a challenge for her to get to doctor's appointments. And the caregiver receives training to cope with Mildred's symptoms as well as her own stress. And then Mildred receives GUIDE respite services, allowing Anne to take a break. So I think, there's lots of information, and I think that sometimes real life scenarios give you a better understanding, or at least that's how my brain works, and it helps me to understand. But as far as qualifiers, there's specific criteria that must be met in order for a person to be able to participate in this program. So first and foremost, I think it's important to note that it does not require a doctor's order like palliative care or hospice care. So anyone can refer themselves or a loved one. And that's not to say we don't get referrals from physicians, but point being, there doesn't have to be a doctor's order in place to receive this support. So other criteria is there has to be a diagnosis by a clinician of either dementia of any form or any stage, or a cognitive impairment. And then the big one is they must be enrolled in traditional Medicare, Parts A and B, and not Medicare Advantage plans. Unfortunately, we realize that this, eliminates about 70% of people who are eligible to participate in the program. But again, this is a pilot program. So hopefully over the course of the next 8 years, Medicare will open this up to more eligible insurance plans. And then the other thing is they can be either living in their own home, independent living facility, assisted living facilities, memory care units, or, but they cannot be in a skilled nursing facility. So they cannot be living in a facility with skilled nursing in the form of rehab or those sorts of things. And then the other thing is they cannot be currently enrolled in hospice or a PACE program. So then going forward, after we've, verified their insurance and confirmed that they meet the eligibility requirements, we will schedule an assessment visit, and that's conducted by the care navigator. So after everything's been verified, I will reach out to the caregiver, ideally because we prefer for the caregiver to be present for the assessments, simply because, with the disease, the person we're assessing may not be able to accurately always tell us the things they're able to do and the things they're not able to do. So that's where the caregiver really comes in and can confirm whether some of the answers are actually valid or not. And then as far as the assessments go, the assessments we do are outlined by Medicare. So these are things that they have encouraged us or mandated us to do. So the various assessments we do are looking at their activities of daily living, the clinical dementia rating, the functional assessment, the FAST tool, the ZBI or Zarit burden. This is for evaluating caregiver burden. And then the HRSN, so health-related social needs. If they're living at home, is it a stable place for them to live? Do they have, working fire extinguisher or smoke detectors or those various things? So after we do all of those assessments, that information gets reported back to Medicare. And they're taking about 3 weeks currently to get back to us with whether or not the applicant has been aligned to the program. That's the verbiage they're using, is aligned. And once they look at the information, they will assign them a tier level. Tier 1 is your earlier stages. Tier 2 and 3 are moderate to severe stages of dementia. So the big component or big benefit for many people of this program is patients that are aligned to tier 2 or 3 are eligible to take advantage of a $2,500 respite care benefit that Medicare will pay for from the moment that they've been aligned. So unfortunately, it's not calendar year, but the date that they are aligned, or the day we hear back from Medicare. So the respite care component can be used either at home. If they're in an assisted living facility, we can provide respite care services there as well, or at an adult day center. And so we will line up respite care through one of our partner agencies. That is one of the stipulations that Medicare has for this, meaning if an individual was to go out and hire their own private caregiver, or excuse me, private duty support system, respite care worker, Medicare will not reimburse the family for that service. It has to be through one of our partner organizations who we've vetted and, is established. So after we've done the assessments, they've been approved, all of those things, what we do is we provide ongoing care management and care coordination. And what that means is we're doing monthly, sometimes multiple times a month, check-ins with the caregiver or the person living with dementia. And that's to identify any increased needs, progressions of the disease, if there's certain behaviors that they are seeing, whether that's wandering, sundowning, hallucinations, delusions. My role is to help them understand that these are components of the disease, and how do we navigate that to keep them safe, and ideally out of the hospital. So the reality is, a lot of people that are living with dementia are also dealing with other diagnoses. So for instance, I have some patients who have dementia, but then they're also in renal failure and on dialysis, or they're dealing with a cancer diagnosis. And so in those situations, we are sort of a go-between person for the family and the provider, coordinating their care, helping them, schedule doctor's appointments, looking at their medication list, and are there high-risk medications that they are taking that might potentially be contributing to some of the symptoms they're experiencing, whether that's, falling or dizziness. And then, looking, are they on blood thinners? Do we need to reevaluate whether or not that's still beneficial to them if they're at risk of falling and having, internal bleeding? And then, of course, there are times where we identify needs beyond what guide can provide. And in those situations, we're going to connect them, put in the referral to connect them with other resources, whether that's physical therapy, speech therapy, occupational therapy, Meals on Wheels, if they are no longer able to safely cook in their home without, forgetting to turn off the oven. Again, I mentioned in that example with Mildred and Anne, transportation. So really, a lot of information we are taking from the caregiver and the individual and helping to create a plan that meets their needs. Then basically, in addition to our monthly check-ins and evaluations, we do reevaluate them every 6 months if we feel like there's been a progression of the disease. And so during that reevaluation period, if they align to say tier 1, when they first joined the program, their symptoms may have worsened and their scores may have worsened to the point where they can receive the respite benefit and are realigned to tier 2 or 3. We also have scenarios where, we're helping the family come to the decision that, maybe it's time to start having the difficult conversations about palliative care or hospice, in which case we'll start those conversations because sometimes the providers need help. I've talked with some providers or people even at assisted living facilities, staff who say sometimes it's helpful for this information to come from someone else other than them, because the family's just not getting it, sort of thing. So we'll have those difficult conversations. We'll also, talk to them about advanced directives. Do you have a living will in place? Do you have a DNR, a most form? What is your code status? We want to make sure wishes are honored for those times when they become incapacitated. So really encouraging people to think ahead and prepare themselves for those challenging moments so that it's when you're in the thick of it, it's less, that's one less thing you have to deal with is, other things. What can I tell you? Any questions so far? I know it's a lot of information.
Well, and I did put, we'll open up for questions, and I did put the links to the guide Dementia Care that you had sent me because someone had asked, and then Marissette had to go, but she found the infographic, and she had me post it there. But let's see questions. Mary, take it away.
Yeah. So when did you guys start providing this service or doing this?
So July 1st of last year is the first time that anyone could roll the program out that Medicare had approved to provide.
July 2020, 24 then?
Yes, ma'am.
Yeah. And have you had a lot of interest in it? I mean, do you have a lot of clients already, individuals that are
We do.
engaged?
So currently we're hanging right around 100 people. And of course, some of the people on our caseloads have progressed to hospice or, potentially passed on. And I think brings up a good point. So, I talked earlier about the qualifying criteria and saying that they cannot be on hospice, but if things get to a point where it's estimated that they have 6 months or less to live, then we'll do the referral to hospice, but that removes them from the guide program. I can tell you, Mary, that by the end of our first year, Medicare would like everyone providing this program to be up to 200 participants. So 6 months in, we're halfway there, but the challenge right now is, so many people don't know about this program. And so we're doing a lot of marketing, whether that's to assisted living facilities or community partners, providers, to get this information out because it's a free program. It's part of their insurance benefit. And while it definitely is for the person living with dementia, it provides a tremendous amount of support to the caregiver. And unfortunately, when you're dealing with a difficult diagnosis, the caregiver sort of kind of, gets lost in the mix because all the focus is on the patient, as it should be. But I think sometimes the caregiver sort of is a big piece of the puzzle that kind of doesn't receive the support they need. So that's what I think really makes this program unique.
Right. You mentioned there are 15 programs in North Carolina already. Are that most of them through hospice programs or agencies? Do you know?
Some are, some are not. Some of them are actually through providers' offices. And on CMS's website, they do have a spreadsheet of all the programs or locations of programs throughout the US that provide guide. And then you'll also see on that spreadsheet the ones that are expected to launch in July of this year.
Right. Because I think the organizations like the one I'm with and that a lot of other people are with in this call could help get the word out about this. So do y'all have like a generic informational sheet or anything?
Absolutely. Is that what you put in the chat,
I
Heather?
did. I did. So there's
Perfect.
the guide dementia care, the PDF from the specifically from AuthoraCare Collaborative, and it also shows their catchment area. And then Connie, you were quicker on the click to add. The link that Connie shared is directly to CMS, and on it there is a participant list that you can click on within like the first sentence, and then it will have it there. So
Perfect.
thank you, Connie, for that.
Thanks.
Other questions? I will give a shout out that if you want to hear more, Laura's actually coming on my radio show, the Aging Well Together show. And so we're going to have a whole radio show on it as well. So you'll be able to listen in a few different ways. I can post that after that's recorded. I think it's February 20th, but I'm not sure.
That sounds right. I'd have to look. It's definitely
Yeah.
February.
Yeah, I think it's February 20th. It'll be the day before our monthly meeting. Other questions? I know I'm still kind of wrapping my head around it because I know I heard about it a lot and now it's here in North Carolina. And so how to get people into it. And one of the things that you shared with me, Laura, that I can share is their referral form for providers. And I can do that. Tara, you have a question as well?
Yes, thank you. Thank you for all this information, Laura. I would like to get this information to our intake folks that hear from people who are often in the community who are trying to find out supports for their loved ones. And I'm wondering if there is a easy to follow. So this map, that the link that's in the chat that somebody posted in the chat goes to a map, and then you click a link and it gives a list of providers. So is that the best way to do it, or is there something that's a little bit more, accessible for people who may not be able to do that on their own? And if there is something, I'm wondering if if I could maybe get a copy so that we can give that to our folks who contact us.
Sure. Unfortunately, what you're talking about, that map of all the providers, that is all that they have released. And I can tell you, when people have reached out to me for guide, but they aren't in one of our coverage territories, I've had to look at, what other providers are able to offer this service in their area. And I can tell you the CMS spreadsheet, ones that says they are active are not all actually active. So some people have had to delay their launch date. So all that to be said, if there's a certain county where you're looking or whoever is looking and they don't want to navigate that messy spreadsheet, I've had to navigate it many times and I'm happy to do that for you.
Mm-hmm.
And the other thing I want to point out is, even if someone does not qualify for guide, whether that's insurance or where they're located or whatever, we still very much encourage people to reach out to us, because we're still going to identify support systems available to them, even if we're not able to provide it.
Mhm. And I did just go ahead and put that referral form. I was multitasking, and it's so you can fill it out and then send it over to Laura. And again, right, I'm assuming that'd be the way that you would say, okay, well, this is the quickest way I can help connect you. Cassandra shared, is there a creative way that we can facilitate getting this information to caregiver support groups?
Absolutely. So we've definitely done some presentations for caregiver support groups. If that's something of interest to you, we can definitely arrange for one of us to come do that. Otherwise, the electronic flyer for guide is a good option, or I can mail you brochures as well that we have, and those are trifold brochures, but they're located at a lot of senior centers and those community resource type places.
Other questions? All right. I think you've got us all starting to think and brainstorm how we can work together, how we can get the word out and help to advance this this initiative. And I want to say something pithy like guide people to guide, but all right, so I said it. Laura, thank you so much. Really, really helpful. Your contact information, I feel like you put it there earlier on. If you wouldn't mind putting your email again as the chat goes on, that would be great.
Absolutely. I'm happy to put that in there again, and definitely encourage anyone to reach out to me by phone or email if you have additional questions. I don't believe I said this earlier, but in terms of the counties that I serve specifically as a care navigator, my counties are Caswell, Person, Durham, Orange, and Chatham County. But again, we've provide services to 12 counties total, but those are the ones that are specific to me. Of course, if there's a need outside of those areas, we do have other care navigators on staff that are assigned to those other territories.
And then there's a question in the chat about whether we can distribute to our members the North Carolina Resources for Guide. Connie was asking me that separately. We'll need to take a look at it and see what can we share and put out even into our next email, the next email I send to all the members. And we could potentially put the flyers and put the list of the counties and places in North Carolina. Tara asks, is there a list of the 12 counties that are covered? Do you mean as part of AuthoraCare, or in the AuthoraCare, in the first guide that I posted from, it has a picture of that. Yes, and I'm looking at that right now. So
Thank you.
I can potentially share that just so people see what, let me just do that real quick. So you see what, y'all see that now? I literally scrolled down. And so this is the PDF that's in the chat that if you click on it, you'll have access to, but there's the counties, that AuthoraCare collaborative. And then you'll see, this is what it looks like. It's like,
and if anyone prefers, I can also share a PowerPoint that I can send to you, Heather. I personally don't like to use PowerPoints when I'm speaking just because it trips me up, and then I say stuff ahead of the slide and it's a whole thing. So
and I realized I called it, I'm so used to using the word collaborative that it's the AuthoraCare collective. And I know I hesitated. I waited for a while till I added it because I didn't want to distract people from what you were saying, but wanted to make sure that folks have. And we'll make sure to add that to upcoming email distributions, our newsletters, if you will. So we'll add the information both about AuthoraCare and about Guide, in particular in the Guide list in North Carolina. Thank you, Laura. Thank you so much. This and please, no pressure, no guilt, but we'd love for you to join the coalition. We'd love for you to become more active, and we will keep you busy with questions. And that way, we have a liaison directly to Guide. So because let this be a first of a number of updates, even how it's going. So consider this an open invitation to be, hey, when it's time for an update or anything, just this is what we do. We bring our folks together and convene and use our collective energies with our different organizations to spread awareness.
Absolutely. Thank you guys, and appreciate what you do for the community and for taking the time to join me today. It definitely takes a village, and I'm happy to be a part of that village, and I'm sure all of you are as well. So thank you very much. I am going to have to hop off to join another call, but I will re-add my information in the chat, and maybe I will see you at an upcoming coalition meeting.
Thank you so much, Laura. Yay.